In this presentation, we are going to discuss about the Unit 4 Hospital Information Systems and Supportive Services for the course code Cbm351 Hospital Planning and Management, presenting by Mr. R. Vijay Prakash, Assistant Professor, Department of Biomedical Engineering, Rohini College of Engineering and Technology, Kanyakumari District. Course objectives to study about to introduce the relevance of this course to the existing technology through demonstrations, case studies, simulations, contributions of scientists, national international policies with a futuristic vision along with socio-economic impact and issues. The students should be made to understand the principles, practices, and areas of applications in hospital management. On successful completion of this course, the students will be able to comprehend the quality aspects specified by management decisions and related information requirements. Types of management decisions, information requirements for different decisions, source information, challenges in information management, role of technology in decision making, and ethical considerations. Clinical Information System (CIS). Integrated systems that manage patient data and support clinical processes in healthcare settings. CIS are designed to enhance the efficiency, accuracy, and coordination of patient care. Clinical information systems are crucial in modern healthcare, providing healthcare professionals with the tools they need to manage patient information, streamline operations, and improve the quality of care. Below is an average of CIS, their components, benefits, and challenges. Administrative Information System. It's an integrated software applications designed to manage the administrative and operational aspects of an organization in healthcare. In AIS, typically focus on tasks like patient registration, billing, scheduling, and human resource management. Key components of Administrative Information System: Patient Management System, Billing and Revenue Cycle Management, Scheduling Systems, Human Resource Management Systems, Supply Chain and Inventory Management Systems, Financial Management Systems, Compliance and Risk Management Systems. Support Service Technical Information System. These are integrated software systems that manage the technical support functions within an organization. SSTIS handles tasks such as facility management, equipment maintenance, IT support, and other technical services that are vital for the smooth operation of an organization, particularly in environments like hospitals, universities, or large corporations. Key components of supportive technical information system: facility management system, equipment maintenance systems, IT support and help desk system, asset management systems, environmental monitoring systems, security and surveillance systems, energy management systems. Medical transcription. It is a critical process in the healthcare industry where voice recorded medical reports dictated by healthcare professionals are converted into written text. This text is then added to the patient's medical records. The role of medical transcriptionist and the evolution of the field, including the integration of technology, are essential components of modern healthcare documentation. Below is an average of medical transcription, its process, benefit, challenges, and future trends. Process of medical transcription: dictation by healthcare providers, transcription, editing and proofreading, formatting and submission. Medical medical records department. The medical records department maintain records and documents relating to patient care records. The quality of care rendered depends on the accuracy of information contained in medical records, its timely availability to, and the extent of utilization by the professional staff. To achieve economy, accuracy of information, and good communication, which are of vital importance to the medical record system, all information should be concentrated in the original medical records of patients. This should be indexed and filed in the department. The three basic principles of medical records are accurately written, properly filled, and easily accessible. Location. Flowchart of medical records on admissions of patient and the flowchart of medical records on discharge of patient are displayed in the flowchart. Central Sterilization and Supply Department. Despite the unprecedented way advances made in the medical field, hospital-acquired infection remains the hospital's single most serious concern that neglects some of its otherwise good work. It is acknowledged that even in advanced countries, approximately 5% of all hospital patients develop infection after being admitted. Given the proof standards in our hospitals, this figure is likely to be much higher in India. To combat this ubiquitous menace of infectious caused by pathogenic microorganisms, hospitals have over the years developed a scientific method commonly referred to as the central sterile and supply system. Objectives: process and sterilize equipments and materials under controlled conditions by trained and experienced personnel, thereby contributing to total environment control in the hospital. Affect greater economy by keeping and operating the expensive processing equipments in one central area. Achieve greater uniformity by standardizing techniques of operations. Gain a higher level of efficiency in the operations by training personnel in correct processing procedures. Functions: receiving and storing soiled materials used in the hospital, determining whether the item should be reused or discarded, carrying out the process of decontamination or disinfection prior to sterilizing, carrying out specialized cleaning of equipment and supplies, inspecting and testing instruments, equipment and linen, assembling treatment trays, instrument sets, linear packs, etc. Design: the workflow pattern should be planned in such a manner that the personal traffic and movement of supplies and equipment is accomplished in an effective manner. The flow of work is continuous from receiving to issuing without retracing steps and the receiving and cleanup areas. Pharmacy. The pharmacy is one of the most extensively used therapeutic facilities of the hospital and one of the few areas where large amounts of money are spent on purchases on a recurring basis. It is also one of the highest revenue generating centers. A fairly high percentage of the total expenditure of the hospital goes for pharmacy services. Functions: purchase, receive, store, compound, package, label, and dispense pharmaceutical item. Serves as a source of drug information to physicians, pharmacists, and other healthcare professionals and the patients. This involves compiling, storing, retrieving, and disseminating drug information and providing pharmaceutical device and consultation regarding drug therapy. Participate in hospitals' educational programs, plan and organize the pharmacy department, establish policies and procedures, and implement them in accordance with the hospital policies. Distribution: drugs sent to the nourishing units for flow stock inventory. These are items generally stored in the units for the use of patients but not charged to them. Drugs that are sent to nursing units specified for individual patients as prescribed by the doctors and are changed to them. In most of our hospitals, this is not done. Patients are asked to make buy their medicines from the pharmacy, which are then given to the unit nurse to be stored in medication carts with individual drawers for each patient. Prescription drugs by the pharmacy on the strength of a prescription given by a physician. These are largely paid for in cash and represent the vast majority of drugs, both in terms of quantity and cost. Storage area: bulk storage, active storage, refrigerated storage, volatile and alcohol storage, secured storage for narcotics and controlled drugs, storage for general supplies, equipment, filter, stationery, etc. Good food is important in the treatment of the patient and in a part of his total care. The food service department in today's modern hospitals ranks as one of the major departments It is headed by a specialist who is either a professional manager or a chief dietitian. Most people tend to pass judgments on the cleanliness of the hospital, the personal care and attention given to them as patients and visitors, and on the quality of food. Functions: provide the best possible food at a cost consistent with the policy of the hospital. Buy to specifications, receive supplies, check their quantity and quality, and store, produce, portion, assemble, and distribute food. Establish standards for planning, menus, preparing and serving food, and controlling meals. Standards must be established before setting up food purchase specifications. Establish policies, plan layouts, and equipment requirements. Plan and implement patient therapy, education, and counseling. Advise patients and their families on special. Receiving area and control station. All internal control measures described under materials management apply to this area too. The food service flow chart. Design a typical food service department. Laundry service. Laundry and linen service is one of the vital department of the hospital. Criticism of linen service is one of the most frequently heard complaints in the hospital. Attention to patients' personal needs and comfort is as important as the physician's medications. The care tendered by the nurse and appetizing food served promptly and attractively. Besides helping in maintaining a clean environment, which is aesthetically significant to patients, clean linen is a vital element in providing high quality medical care. Functions: collection of or receiving soiled and infected linen, processing soiled linen through laundry equipment. This includes sorting, slicing, and disinfecting, washing, extracting, conditioning, ironing, pressing, and folding. Inspection and repair of damaged articles, their contamination and replacement. Assembling and packing specialty items and linen packs for sterilization. Maintenance and control of active and backup inventories and processed linen. Design a plan of laundry. The laundry functions effectively only when it is planned strictly in accordance with the work sequence, namely receiving, processing, and dispatching. Figure shows the flowchart of the laundry showing trends of traffic. Textbooks: RCGOL Hospital Administration and Human Resource Management, PHI 4th edition 2006. GD Contest Hospital Facilities Planning and Management, TMH, New Delhi 5th edition, reprint 2007. Caesar, A. Caesars and Albert Sarah, The Practice of Clinical Engineering, Academic Press, New York, 1977. References: Peter German, Health Sector Reform in Developing Countries, Harvard University Press, 1995. Norman Metzger, Handbook of Healthcare Human Resources Management, Aspen Publication, INC, Rockwell, Maryland, USA, 2nd edition, 1990. Arnold D. Calicioni and Stephen M. Shortell, The Healthcare Management, 6th edition, 2011. Blaine, David, Werner, Eric, Health and Social Organization Towards a Health Policy for the 21st Century, Calderon Press, 1994.